Well, this week is Black Maternal Mental Health Week. It brings attention to the unique and often overlooked mental health challenges that Black mothers face during and after pregnancy. So Lucinda Zeinelabdin from our Metro Health District is joining us now to talk a little bit more about this. Thank you so much for joining us today.
Thank you for having me.
Absolutely. So again, bringing attention to unique and overlooked mental health challenges for Black mothers. What are we talking about here? What are the unique challenges?
Yeah, so while 20% of new mothers experience a maternal mental health condition, for Black mothers, that number jumps up to 40%. And with that being said, many are still not getting the care that they need. The reasons for that could be varied, but it's disheartening either way because we know that maternal mental health conditions account for about 9% of pregnancy-related deaths.
And so, yeah, I mean, that's a part of the struggle as well as having people being able to speak up and know that there are resources available. What, if any, what ways can we empower these mothers to speak up and address the challenges that they have?
Yes, so that's a great question. I think the first thing that we need to do is let people know they're not alone. These conditions are common. They affect 1 in 5 people. And then we need to let moms know that the city of San Antonio wants them to know that they deserve to be heard and that their concerns matter. And so moms and their families should ask questions, voice concerns, and advocate for their health, because taking care of your health, and that includes your mental health, is caring for your baby. And on the other side of that, it is really critical that when someone does speak up, that healthcare providers are actively listening and validating those concerns, and then working with the patient and their family to address those concerns.
Yeah, you know, when you're pregnant, once the baby arrives, it's a tremendous life change. I mean, there are just so many new challenges. It may be a little bit hard for people to see that a mom is struggling. So what can friends and family look out for?
So some urgent maternal warning signs include things like shortness of breath, chest pain. It could be persistent fatigue or persistent headaches, even thoughts of harm, like harming yourself or someone else, including the baby. And while those can be urgent signs for a maternal mental health condition, they can also be signs of a cardiovascular or neurovascular emergency, like a heart attack or stroke. So it's really important to encourage people who are experiencing any of those signs to get medical attention right away. And for the moms, if you feel like something's not right, trust your instincts. You're the expert of you, and so seek out that medical attention and be persistent. It's not always the easiest thing to do, right? Nobody likes to rock the boat, but your life could really depend on it. And you can access local mental health resources as well as family support services by calling 311.
Okay, awesome. Yeah, and you know, we always say it takes a village to raise a child, but you know, all of us as a community can help everyone. And anyone looking for more information, you can also go to sa.gov/health. But again, it is Black Maternal Mental Health Week, so more resources on that available online as well. But Lucinda, thank you so much for coming in today.
Thank you.